Hi friends, if you're new to my channel, welcome, and if you're returning, welcome back. That very first therapy session can bring feelings of fear and overwhelm. Understandably, this is what happens for most of us when we are scheduled for that very first therapy session. In this video, we are going to talk a little bit more about what to expect in that very first therapy session so that we can walk into the space with confidence. My name is Raquel Perez, and I am a licensed professional counselor candidate in the state of Colorado. Let's get started. Let's say that I have done all of my homework and I have narrowed down my search to one therapist. I have found one therapist that I think is going to be a good fit. So I have gone ahead and scheduled a 50-minute session with this therapist. What can I expect now? Well, the first thing is it's important to know that all therapists are a little bit different in their approach. They have different training or trainings, and they're going to show up a little bit differently in the therapeutic space, which is all good. It's all good. But that's what makes some a good fit and not others. It's also important to know that at any point in our therapy journey, we have the freedom to pick up and move on to a different therapist. And that can be after that very first therapy session or any point after in our therapeutic journey. If at any point we are just not finding a good fit with our therapist anymore, we can get up and move on to a different therapist. So once you've scheduled that very first session, you will be asked to fill out some documents, just as you would at any other medical appointment. And so this might be done electronically through some kind of a client portal before your first session, or it might be done during your first session. If it's done during your first session, you're probably going to be asked to arrive a few minutes before your scheduled appointment time to allow enough time to fill these documents out. If it's done electronically through a portal, then that'll be done at some point, any point before your first session. Now, what documents are you going to be asked to sign and fill out? Some of these documents are going to be consents. These consents go over information like office policy, what the privacy agreement is between you and your therapist, what your therapist would do or could do with your information when they have obtained that information. And so it is important for you to carve out a little bit of time so that you can go over these documents and bring up any questions that come up for you to your therapist before you sign those documents. Now, the other documents, which are some questionnaires, more than likely will have some open-ended questions that they'll ask of you. These questions usually go over brief medical history, your brief medical history, some brief family history, and they'll likely have a question that asks about what brings you to therapy services at that time. The purpose of this document is really to give your therapist a little bit more information about you and a little bit of history about you to know really where the conversation is going to go when they first meet you. So another good question is, how long is this going to take? How much time should I carve out of my day? It's important to know that a 60-minute psychotherapy hour is considered to be, in actual time, 50 minutes. On a rare occasion, like in my case, sometimes we will go between 50 and 55 minutes per session. And so that's just important to know that in actual time, it will be more like 50 minutes, and in some cases, 50 to 55 minutes in length. And that's the amount of time that you're going to want to allot. If you have to fill out those documents though ahead of time, you might have to arrive a little bit early, which would put you more at that hour for that first session. Now, it's also important to note that now, with the convenience of telehealth and teletherapy, we can see our therapists virtually, but many times there are some people who also will see us in person. And so, of course, making time for that commute to and from If it's our very first session, we're going to, and we're probably a little bit anxious, we're probably going to want to head out a little bit early so that we have a good lay of the land and know exactly how to access our therapist's office. If it's virtual, then really it's going to just take about that 50 to 55 minute time frame. And so, so that makes it much more convenient. Another question you might be asking yourself is, what in the world should I talk about? My best answer is, don't overthink this and don't get stuck on this idea or this question. Really, the way I like to explain it is your job is to just show up. Just show up. And really the therapist's job is to open up the conversation and to create a space that feels comfortable and a space that feels safe so that there is a fluidity in conversation. And so really when it comes to what should you talk about, again, I wouldn't really get stuck on this or hung up on this idea or question too much, because those conversations you will find that surprisingly do become very fluid. So another thing that I like to describe therapy sessions as is this is time that is allotted and designated just for you. In other words, this conversation is going to look different than other conversations you've had in your life, maybe with family members or friends, because it is all for you and your process. The therapist will really have no need to interject any information that isn't geared just for you. And so it's kind of nice to think about it in that way, because you will have a 50-minute time slot allotted and dedicated just for you and just for your process, which actually sounds kind of nice when you think about it that way. The last note is that remembering that therapists are human too. They're human just like you. And so really it's a conversation that you are having with another human that's there to hold space in safety and in comfort. And so remember, it should always feel safe and it should always feel comfortable. And you should always feel like you have the ability to open up with questions or to present feedback to whomever it is that you decide to work with, because the safety should always be there. Well, friends, that's all I have for this video. Thanks for taking time out of your day to watch it. I really appreciate that. If you have found it useful, please hit that like button down below. If you want to get more free mental health content and resources on a weekly basis, hit that subscribe button down below. And if you have questions or comments, please slide those into the comments down below. Thanks again, and I hope to see you next time. Bye for now.